What's up? I'm Hutch, and you need to better understand the tubes that your patient is on so that you can coordinate your treatment and also pass the NPTE. Other than oxygen, most tubes are for eating or excreting. A nasogastric tube is temporary for feeding or gas release. Long-term feeding tubes include a G or a PEG tube straight into the stomach or a J tube straight into the intestines. Both would be inserted surgically via a stoma. Tubes for bowel movements are also placed surgically and can be called a stoma or an ostomy. These tubes can be placed anywhere in the digestive tract and will have a prefix based on where they are placed. In addition to emptying these bags regularly, they will also need to be burped to release gas. For urine, you'll most commonly see a Foley catheter, which is a tube inserted up the urethra into the bladder and attached to a collection bag on the other side. The bag usually has a hook or a strap so it can be attached to the patient's leg or assistive device and can be used for longer term needs. However, there is some risk with changing out bags and such of a urinary tract infection, so a better long-term option would be a suprapubic catheter. This is a tube that is surgically inserted into the bladder via the abdomen, and another good reason for its placement is a blocked urethra. Another long-term solution can be intermittent catheterization, which is where a patient will usually self-administer a catheter, placing a tube up their urethra to drain the bladder, and then remove that tube until the next use. You may see this more often in people with neurologic disorders who have good cognitive capacity. Short-term options include a condom catheter for males or a sponge catheter for females, like the PureWick brand, and this can be attached to a vacuum. Other tubes you might see include a chest tube, which will be for draining air or fluid from the pleural space, or a shunt, which is a tube internally connecting the brain to the abdomen to release pressure. It's time for NPTE Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. The J in J-tube stands for jejunostomy, as it goes directly into the jejunum of the small intestines. This allows for nutrition and medications to be inserted into the intestines for patients that cannot tolerate tubes higher up in the digestive tract. Hopefully that covers all of our bases. If not, you can always check out the description box below for a link to my notes on Etsy, or comment with questions or suggestions for things I should do in the future. Good luck studying. Go change the world.